Okay, let's get started here. That was a full one more minute wait. So again, welcome to everybody who's joined us today for our COVID-19 response training. We've got we've got a few experts here today that will be sharing information with you. And we really want your questions today to make this really meet your needs. So please use the chat feature to post any questions throughout the training, and we'll have some Q&A time at the end. And if you put questions up and we can fit them into our presentation, we'll do that at the time, but we'll certainly have time at the end to answer all questions. So with me today, as part of your panel, we have Anna Higgins, our Executive Director of Innovation. We have Joe Hallams, our School Safety Specialist. We have Gail Burton, our school nurse, and Jimmy Keegan, our facility manager. So with that, let's get started.
Thank you, JL. I'll go ahead and get things started, and we'll kind of pass it on to the different people on the panel so to share their information as we proceed through. So as we kind of entered COVID-19 early last year, there was kind of a scramble to figure out how we were going to navigate these new waters. In response, High Desert ESD and the leadership decided to form what we referred to as a hub and spoke team. Within that team, we had a core group of members, plus we brought in ad hoc members as well as needed to determine our best course of action in being able to provide the services we need to our community in the safest possible way. Over the summer, the decision was made to kind of retire the hub and spoke team, and utilizing that team, we're going to leverage what we had in place prior to this, which was our building safety team. Now, the building safety teams are kind of under the umbrella of the district safety committee or district safety team, which is something that JL has overseen for many years. Historically, this is kind of an OSHA response, doing building inspections to make sure that we don't have 5 extension cords plugging in a space heater or other OSHA type concerns. But we figured this is the best way to get the direct information from to and from leadership to make decisions to make sure that our buildings and our employees and the communities that we serve are the safest possible. So we basically have 2 departments that will be responding from this point going forward. That'll be the district safety teams or building safety teams within each facility that we oversee, as well as a facilities department run by Jimmy, who will be speaking in just a few minutes. So at this point, I think it's always necessary to kind of review how we continue to keep ourselves and therefore our community safe. And I'm going to invite Gail to speak to this for a little bit.
Thank you, Joe. I just had a couple things I wanted to mention. You know, I think we're all really have gotten very familiar with how COVID spreads and why we wear very close fitting masks that are comfortable up above our noses and below our chins that don't have openings on the side. Sometimes those surgical masks can gape right here. And so it's important to make sure you have a well-fitting mask that doesn't have fatigued elastic in it. I notice a lot of times people's masks are falling down and they're continually popping it up, trying to keep it up above their nostrils. So that's one thing I wanted to mention. And Jimmy will go over kind of the cleaning stuff. You can see on the slide on the left kind of what we look at in terms of things that we touch with our hands and that need to be cleaned, and just the precautions like masking, being vaccinated, or just, you know, huge ways of keeping ourselves and others protected. Washing your hands for at least 20 seconds with soap and water. And if you don't have that, a hand sanitizer that's 60 to 95% alcohol content. You know, covering your coughs and your sneezes, not touching your face, you know, all the things that we do during cold and flu season, staying 6 feet apart. And then just on the slide on the right, I just wanted to mention, you know, as we've had COVID cases come up among our employees and students, I think we're so used to having different symptoms in our lives that weren't COVID related, that maybe you have vomiting and a headache and you don't really equate it to COVID, or you have a runny nose and a cough and you think, oh, I have allergies, but really stopping to think and relate it to potential COVID and making sure that you're not coming to work if you have any of those symptoms, or if you notice anyone else that you're working with having those symptoms, or children that we're working with, to really take action right away so that we don't end up having to close programs and send people home and so forth. So anyway, just those are just kind of the highlights of what you see on these slides that I wanted to speak to.
Great, thanks, Gail. And I think it's important to note that, study after study have shown that schools are actually not good distributors of the coronavirus COVID. It's actually from the staff giving it to each other. So really take care of yourselves. And if you're not feeling well, please stay home and stay in constant communication with your supervisor. So as we've continued through this and progressed, we get a lot of questions about how we can find the most updated information that High Desert ESD has to offer our employees. We feel that communication is extremely important, that it's necessary that for everybody involved in this response, that we continually communicate with you as best we can, and then also open up the avenue of communication for you to communicate with us. Thus, we have trainings like this, but also we find that the information provided on the dot, which used to be our, what was it called, Anna? I can't remember, sorry.
You caught me trying to pull up some information about your voice. It was the work at home.
It used to be referred to as the work at home. Now we refer to as the dot. And some of that information is just, where do I get this information? So if you go to our home screen, the arrow will show that at the very top right is our hyperlink to get to the dot. Once you navigate over there, you will come to this screen, and you can see the big 4 boxes at the bottom specifically have to do with COVID response. Within those, the COVID handbook is something that we're continually working on. This is the current information that you will find underneath the COVID handbook link, but there is some more to come. But right now, I just want to hand this over to Anna to kind of speak to what we have within this section. Anna.
I just posted, as a follow-up from what Joe was saying, both this getting you information getting the information you need that's changing as it's changing, but also hearing from you. This has been a really dynamic, important way that we've had two-way communications is the Your Voice. I just put it in the chat. So many of you have submitted questions, and this is a way for us to both keep a pulse on what questions people have, but also to share the answers to those. So there's consistent answers going out in a timely manner. So those fall on the dot. What you're looking at right now is a updated 2-pager, which we have a modification also for the families we serve, especially in our contained programs like our early childhood programs. This one is particularly designed for us as staff, and it focuses on, as you can see, really some big areas. When do I stay home? When can I return to work? And how do I make sense if I've been exposed to COVID or I've tested positive for COVID? And JL and Gail and myself and others can attest that in many ways, each case of exposure, whether it's an individual or happens within a classroom or happens within an office building, is nuanced. And we have to wrap a small team around it to collect all of the information and then make sense of a response alongside our local public health. But some high level information, again, this is reiterating what a framework we've been working from for almost 2 years now, but this concept of person 1, person 2, person 3, understanding that person 1 is someone who has been identified or tested positive for COVID, or is a presumptive, what the medical providers are calling a presumptive case. So that's really kind of that's the starting place of our exposure proximity. So if we were in a space with someone who later then tested positive for COVID, we as a team are looking back to see who did that person interact with 48 hours before they started having symptoms or had a positive test. So that speaks to this proximity of exposure. The other layer of complexity is around those of us who are vaccinated and those of us who aren't. So while there is a vaccine mandate coming down from Oregon Health Authority that will be the last day or the immediate effective day will be October 18th, there will still be some of us who for example, have a medical exemption to getting vaccinated. So this still is relevant and it will be this year. If someone is fully vaccinated, their path after exposure is different than if someone is not fully vaccinated. So again, lots of nuance case by case. What I need y'all to hear is if you have been exposed or you have tested positive or you have symptoms that are COVID symptoms, we need you to be in touch with your supervisor, whether that exposure, whether that test happened within your professional schedule or it happened on the weekend. We can really mitigate exposure the sooner we know. So last year we had a lot of folks who were able to tell us that they were a person too, that on the weekend they were exposed to someone who tested positive for COVID. And then we're able to mitigate exposure happening in the workplace. So while it feels like a lot of information sharing, we're again this year asking anyone that has tested positive, has symptoms, and or knows that they have been exposed to COVID to get in touch with their supervisor, who will then pull in the COVID response team, JL, Gail, and others as needed. I think that's probably all that I want to touch on. So I'll hand it back to you, Joe.
I'd just add, Anna, thanks for that summary. And I think typically you're going to get one or two of more than one of us for those to review those scenarios and have multiple voices to help you problem solve the case that you have in front of us.
Great. Thank you, Anna and JL. So I think it's important to note that there is no shortage of information from various sources out there on anything having to do with COVID. Our response, though, is solely based on really three sources. It's going to be our local public health and St. Charles Health System, the Center for Disease Control, but mostly it comes from our Oregon Health Authority. And this is kind of our guidance that we need to frame our response to. So any rules that we put in place, any procedures that we follow really are based out of this information here, which is available from the Oregon from Oregon Department of Education. Historically, it was called the Blueprint, but now it's just called the Resiliency Framework for the 21-22 school year. This is the rules that we have to follow in putting together our guidance. One such is, as it was mentioned before, is the vaccine mandate. And JL, did you want to speak a little bit more to that?
Yeah, thanks, Joe. What I would just add here, all of us now have received our email requesting either your vaccine card or one of the two exception forms. And we're still in process of collecting that. And if you haven't completed that, I ask you to get on that as soon as possible and get us the information. And again, if you don't have that email and you need that again, I'm happy to send that link to you for you to either, again, upload your exception cards or your vaccine card. And happy to talk with you about the vaccine. If you have any individual questions that you'd like to run by me, I stand ready to help you with that. Thank you.
So as Anna mentioned before, we are still responsible having open communication with our local health authorities when there is a case. Specifically, we need to know who was in contact with who. While some school districts have retired their QR codes, specifically Ben Lapine School is no longer utilizing theirs, from what I understand, the information I received. Due to the nature of our position, our services that we provide, and many of our employees are in and out of various buildings throughout the day. Any of our facilities, we're still going to require that people either physically sign in. There will be paper sheets that they can physically sign in, or utilize their mobile device and scan in and out. And again, it's necessary so we can turn around and share that information with local health authorities as quickly as possible. So we know who is in contact with who, we can get the right information to the right people as quickly as possible. As we've seen, things have changed over the last 18 months. Some of that has to do with how we're responding to our cleaning of our environment. Jimmy, would you kind of update everybody on current cleaning protocols and what we're doing to keep our buildings as safe as possible?
There we go. Sorry about that. Thanks, Joe. Yeah, if we reference these slides here, we'll see some of the best practices for cleaning and disinfecting during COVID-19. I just kind of want to go over those and also talk a little bit about protocols that we're taking within the organization in regards to cleaning and disinfecting. As most of you probably know, COVID-19 is mainly spread through air, but it's also still important to be diligent about cleaning surfaces to remove germs and dirt. We want to be careful on how we clean. We want to make sure that we're using disinfectants that comply with EPA, and those disinfectants that do comply with EPA will have a registration number actually printed on top of them. Of course, it goes without saying, we want to make sure that we're keeping cleaning supplies out of the reach of children, and we're certainly not letting them, children or students, to apply disinfectants. We want to follow application instructions printed on the labels, and of course, do not mix or dilute disinfectants. Again, making sure that disinfectants that we use have that EPA regulation number on them is very important. If you don't see a EPA registration number on a disinfectant you're using, please don't use it. Reach out to me. I'm happy to recommend a product that does in fact have a EPA registration number, because federal law does require that number to be printed on each and every label of authorized disinfectants. Within our organization, currently we're on a 5-day-a-week cleaning schedule, Monday through Friday. Staff within different facilities has their each and own way of cleaning, but generally between cohorts, we're wiping down surfaces. In the evenings, we're using electrostatic sprayers to clean harder to reach surfaces, and that is happening 5 days a week as well. As far as filtration goes, we've upgraded our HVAC systems to include a MERV 13 filter and an ionization units, which basically just help capture harmful air particles that could potentially lead to the spread of viruses, including COVID-19 virus. As far as these protocols that we're enacting, and as an organization, we're going to continue to follow these and take these additional measures like the filtration and like the electrostatic sprayer and cleaning diligently 5 days a week to ensure that we're providing these extra levels of safety, at least until the end of COVID-19, or at least until it seems like it's behind us, hopefully sooner than later. And I guess kind of in closing, the bottom line, the bottom line seems to be that being diligent about cleaning and disinfecting can help us reduce the risk of the spread of these viruses. So please follow the proper cleaning protocols and administer the proper cleaning disinfectants. Remember to be diligent about not only safely cleaning and disinfecting classrooms and work areas, but also remember to always follow mask wearing and distancing to help prevent the spread of harmful germs. And that about concludes what I have to say. Thank you.
Great, thanks, Jimmy. Yeah, I think the real thing, having to work with Jimmy this year and Bob in the last year, both are very diligent. Both are doing a great job in making sure that we have all the products we need within our facilities. And I guess that was one thing I just really wanted to add, is that we should be supplying, at least to all the facilities that we oversee as within the ESD, should be supplying you with the proper cleaning equipment that you may need to wipe down those high touch areas between classes or as you can. It is discouraged that we bring in outside cleaning products because we're not sure what we have in the building and then what other people are bringing in. So please try to utilize the products that we provide. And if those run low, please let us know, either myself or Jimmy, and we'll make sure to get you what you need as quickly as possible. So this pretty much concludes our training, or the information that we have for you today. Again, this was kind of a quick way just to share where we stand now. The most important thing that we felt as a team is to make ourselves available to answer questions to anybody that may have so.